these days circled are possibly her fertile days. She's highly fertile on these days. Hi lovelies, welcome back to my YouTube channel. My name is Cynthia and my channel focuses on women's health and fertility tips. So on today's video, we'll be learning how to calculate our fertile and our safe period using the calendar method and essential tips you should follow when calculating that. So it's very important to know when your fertile window are when you're trying to conceive, and if you're not trying to conceive, it's of extreme importance as well to know when your safe periods are, so you could have unprotected sex without achieving pregnancy. So today we'll be using the calendar method. And before you learn how to calculate your fertile and your safe period, it's very important to know what your menstrual cycle is. The length of your menstrual cycle is of extreme importance to know that. And what it simply means is to calculate the first day of your menstrual period up until the last day before you see another period. So it's very simple to calculate, and the normal menstrual cycle length varies between, so it varies from, so normal from 21 days to 35 days. So that is the normal menstrual cycle length for everyone. So if the cycle length that you have presently falls lower than 21 days or above 35 days, it could be as a result of numbers of factors. So it's very important to see your doctors just in case it falls less than that or greater than 35 days. Your menstrual cycle length, is better for you to get advice from your doctors. So today, this calculation focuses on women with menstrual cycle length between 21 days to 35 days. So some people would mistake menstrual cycle length for how many days you see your period, which is not. So menstrual cycle length is just basically from the first day of your menstrual period, that's the very first day you started bleeding, up until the last day before you start bleeding again. So it usually takes about 21 days to 35 days for most women. So take for instance, you started bleeding on the 3rd of March. So your bleeding started on the 3rd of March, and we'll just do that. So the first day of your bleeding is going to be day 1, day 2, day 3, day 4, and then you stop bleeding, which is fine, but we are still calculating our menstrual cycle length. So we'll continue calculating up until when you start seeing another bleeding. So day 4, this lady has stopped bleeding, but we'll still keep counting. So 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 21, 22, 23, 24, 25, 26. And she happens to see another menstrual period on the 29th. So the 29th is going to be the first day of her next menstrual period, which is going to start another menstrual cycle length. So this particular lady has a 26-day cycle. She sees her period for 4 days, which is absolutely fine. And then the cycle up until she sees another period, that is 26 days. So she stopped here, and then the next bleeding starts on the 29th. So this lady has a 26-day cycle. And for you to know when her fertile period is, it's very simple. So ovulation usually should happen within 14 days based on science. And we've got a standard calculation for this. There's a constant figure which we use, which is 14. So 14 is constant. For you to know when this lady is going to possibly ovulate, because we have to know what our ovulation day is. Ovulation is practically when an egg is released, and when an egg is released, that is when fertilization could possibly happen if there is unprotected sexual intercourse with the opposite sex, if there is no underlying health issues or underlying fertility issues. So 14 is constant in this calculation. For us to know when she may likely ovulate, it's going to be, since her cycle length is 26, so it's going to be 26 minus 14. 26 minus 14, that's going to give us 12. So this lady is possibly going to ovulate on day 12. So day 12, which she's likely going to ovulate, is going to be that day. I'm using different shades of pen so we won't get confused. So I've used the blue shades of pen to write the day of the month, and the ones in red, I've just used them to explain to us how many days cycle length. So the ones in red are the days of her cycle length, and the ones in blue are the calendar months, the calendar days rather. So she's likely going to ovulate on the 12th. So we'll just circle that. So this is possibly, so that's the 12th of her menstrual cycle length. So she could possibly ovulate on that day. And because ovulation must not happen on this exact day it's set to happen, so what we can do is just to add +2 or -2 before the exact day which you have calculated. So basically it's going to be, this lady would likely ovulate on the 12th, but there's high probability that she may ovulate 2 days before that 12th or 2 days after the 12th. So we're going to do plus or minus 2. So plus or minus 2 is going to be on day 10, on day 11, day 13, and day 14. So this lovely lady is possibly going to ovulate. There's a high chance that she could ovulate on day 10, day 11, day 12, day 13, day 14. So she's highly fertile on these days. And then something very, very important we should bear in mind is the spermatozoa, the sperm in the male reproductive tract, could stay in the female reproductive tract. When it's released into the female reproductive tract, it could survive in there for about 3 to 5 days. Very important information we should bear in mind. Since the spermatozoa could stay in the female reproductive tract for up to 5 days, so we'll just add 5 to the earliest date this lady could possibly ovulate. So the earliest date which she could possibly ovulate is day 10. So adding 5 to day 10, it's basically going to be 1, 2, 3, 4, 5. So all of these dates circled are this lady's fertile window. So fertile window basically is when she could possibly have unprotected sex with the opposite sex, and there's a high chance of her getting pregnant if she has unprotected sex with the opposite sex, if there's no underlying fertility issues. So these days circled are possibly her fertile days. She's highly fertile on these days. Take for instance, she decides to have sexual intercourse on day 7 of her menstrual cycle. So if she has sexual intercourse on day 7 of her menstrual cycle, but she hasn't ovulated yet, bearing in mind that the spermatozoa could stay in the female reproductive system for about 3 to 5 days. So if she has sexual intercourse on that day and the spermatozoa is released into the female reproductive tract, so it stays there 1, 2, 3, 4, 5. If she manages to ovulate on that day, the egg just stays in the, so once the egg is released, it just lasts for about 12 to 24 hours. So if she has sexual intercourse, unprotected one, on that day, day 7, she could get pregnant if she manages to ovulate on day 13. Because the sperm is still there, chilling and waiting for an egg to get released. So 1, 2, 3, 4, 5. And she ovulates on that day, peradventure. She's got a high chance of getting pregnant on that day. Or she has unprotected sex on day 9 of her menstrual cycle. 1, 2, 3, 4. The spermatozoa is just chilling and waiting. And there's high tendency that she could ovulate on either of these days. So basically, the circled days are her fertile window, and the ones that haven't been circled are just basically her safe days. So she could have unprotected sexual intercourse on these days that haven't been circled, and there's a very low chance of her getting pregnant on either of these days that haven't been circled. But the days that have been circled, there's a high chance for her to get pregnant for a woman with 26 days cycle. So I said earlier that the normal menstrual cycle length for women could be from 21 days to 35 days. So I'm just going to do a little bit of a giveaway, which is going to be calculating our menstrual cycle from day 21 for women with 21 days to 35 days menstrual cycle length. The first example, we're going to be using it for someone with a 21 days cycle. So 21 days cycle, bearing in mind 14 is constant, so it's going to be 21 minus 14. That's going to give us 7. So this lady could possibly ovulate on day 7 of her menstrual cycle. Don't forget, we're still using plus or minus 2. So a 21 day cycle length, that's going to be 21 minus 14, that's going to be 7. So this lady could possibly ovulate on day 7. Bear in mind, ovulation is not constant, so she could ovulate on day 5, day 6, that's minus 2, and plus 2 is going to be day 8, day 9. So she could ovulate on either day 5, day 6, day 7, day 8, day 9. Plus 5, because the spermatozoa stays in the female reproductive tract for up to 5 days. So plus 5, 1, 2, 3, 4, 5. So from the first day of her menstrual cycle, so that's going to be from day 1 of her menstrual cycle up until day 9 of her menstrual cycle. This particular lady is considered fertile on those days. Those are her fertile periods. So she could have unprotected sexual intercourse on either of those days, and there's a high chance she could get pregnant. And the rest of the days are considered her safe period until she sees her menstruation next. So the next cycle length we would be doing is a 22-day cycle. So for a 22-day cycle, that's going to be 22 minus 14. That's going to give us 8. So since that gives us 8, so she could ovulate on day 8 of her menstrual cycle, which is that day. Plus or minus 2 still is going to be day 6, day 7, day 8, day 9, day 10. So if she has this 5 days to ovulate on either of these days, so her fertile window, it's going to be 1, 2, 3, 4, 5. So it's going to be from day 2 of her menstrual cycle up until day 10 of her menstrual cycle. It's considered her fertile period. She could have unprotected sexual intercourse on those days, and the rest of the days are considered her safe period until her next menstrual period. So that's for a 22-day cycle. So for a 23-day cycle, so 23 minus 14, that's going to give us 9. So her possible ovulation days is going to be day 7, day 8, day 9, day 10, day 11. And her fertile window period would start from day 5 of her menstrual cycle, which is 1, 2, 3, 4, 5. So from day 3 of her menstrual cycle up until day 11 of her menstrual cycle is considered her fertile window period. She could have unprotected sexual intercourse on those days, and there's a high chance of her getting pregnant. The next is going to be for a 24-day cycle. 24 minus 14, 14 is always constant, remember, so that's going to give us 10. So on day 10, she's likely going to ovulate. Day 10, it's on that day, so plus or minus 2 still is going to be 1 on day 8, on day 9, on day 10, day 11, day 12. She could ovulate on either of these days. Plus 5 from the earliest day of when she could possibly ovulate. That's going to give us 1, 2, 3, 4, 5. So from day 4 of her menstrual cycle up until day 12 of her menstrual cycle is considered her fertile window period. So we're going to jump to 26 because we started with that. So I'll just go straight to day 28 to 28 days menstrual cycle length. So for a 28 days menstrual cycle length, 28 minus 14, that's going to give us 14. So this lady is going to ovulate on day 14 of her menstrual cycle, which is that day. So if she ovulates on that day, possibly, so it's going to be a plus or minus 2, just because ovulation is not constant. I'm sure we already know this by now. So that day, so that's going to be, she could either ovulate on day 12, day 13, day 14, day 15, day 16. She could ovulate on either of these days, and she's fertile on those days. So plus 5, because the spermatozoa lasts in the female reproductive tract for 5 days. So 5 days before the the earliest day she could ovulate. That's going to be 1, 2, 3, 4, 5. So from day 8 of her menstrual cycle up until day 16 of her menstrual cycle, this lady is considered fertile on those days. The next we're going to do is 29 days cycle. 29 minus 14, that's going to give us 15. So this particular lady, it's going to possibly ovulate on the 15th of her menstrual cycle, plus or minus 2, that's going to give us 13, 14, 15, 16, 17. She could ovulate on either of these days. And her fertile window period is going to start from 1, 2, 3, 4, 5. So from day 9, so her fertile window would be day 9, day 10, day 11, day 12, day 13, day 14, day 15, day 16, day 17 would be her fertile window period. She could have unprotected sexual intercourse on these days and she could get pregnant. So I'm going to jump straight to 31 days menstrual cycle length, and then we'll do the 33 days, and we're going to come to the end of this video, but this video, I don't want it to be super long. So the next one is going to be 31 days menstrual cycle minus 14. So that's going to give her 17. She's possibly going to ovulate on day 17 of her menstrual cycle, and the 17th of her menstrual cycle, it's on that day. So if she's ovulating on day 17 of her menstrual cycle, plus or minus 2, that's going to be 15, 16, 17, 18, 19. It's when she could possibly ovulate, and plus 5 because the spermatozoa stays for 5 days. So that's going to, the earliest date is 15. We're going to start counting backwards. So that's going to be 1, 2, 3, 4, 5. So her fertile window period is going to start from day 11 of her menstrual cycle up until day 19 of her menstrual cycle. That's considered her fertile window period, and the rest of the days are her safe periods. So the next is going to be a 33-day cycle. So 33 minus 14, that's going to give us 19. So she could ovulate on the 19th of her menstrual cycle, which is that date. And if she's ovulating on that day, plus or minus 2, that's going to be 1, 2, 3. So 1, 2. 1, 2. So from day 17th, 18th, 19th, 20, 21, she could ovulate on either of these days. Adding 5 to the earliest day, that's going to be 1, 2, 3, 4, 5. So this lady is considered fertile from day 13 of her menstrual cycle up until day 21 of her menstrual cycle. So extra bonus for a 35-day cycle length, and we're going to wrap up this video. So for a 35-day cycle length, 35 minus 14, 21. So this lady could possibly ovulate on day 21 of her menstrual cycle, plus or minus 2, that's going to be from day 19th of her menstrual cycle up until day 23 of her menstrual cycle. Those are the days she could possibly ovulate. So she could ovulate on day 19, day 20, day 21, day 22, day 23, because ovulation is not constant. And her fertile window would start 5 days prior to the earliest date she could ovulate. That's basically because spermatozoa stays up to 5 days in the female reproductive tract when there is sexual intercourse. So 5 days prior to that day would be 1, 2, 3, 4, 5. So this lady is considered fertile from the 15th of her menstrual cycle up until day 23 of her menstrual cycle. So these are her fertile periods. So she could have unprotected sexual intercourse on this day's cycle. That's from day 15th up until day 23 of her menstrual cycle, and the rest of the days I haven't cycled are considered her safe periods. So lovelies, if you found this video helpful at all, Please do well to watch out my other videos on fertility tips, and don't forget to subscribe to my YouTube channel. Also, I beg you to please share this video to your loved ones. Share it to your sister struggling to calculate when her fertile windows are and when her safe periods are. Don't forget to like this video and give it a thumbs up so you can get to more and more people. And don't forget, it's very important to learn how to track your fertile and your safe period for you to increase your chance of getting pregnant if you're trying to conceive. So knowing when you're possibly going to ovulate, first of all, knowing when your menstrual cycle is, knowing when you're possibly going to ovulate, and know when your fertile windows are and when your safe periods are, and have unprotected sexual intercourse on those days called your fertile window period, there's a high chance of you getting pregnant if there's no underlying fertility issue. Thank you all so much for watching this video, and I hope to see you all in my next video. And I hope these calculations haven't given us any confusions. You could always pause the video, go back to watch it again, and try to follow the math. It's a very simple math. Thank you all so much for watching this video. I love you all so much, and I'll see you in my next video. Don't forget to like, share, and subscribe. I'll see you all. Bye. I love you.